Hi, I'm Dr. Celine Gelgich.
And I'm Dr. Tori Miller.
Welcome to Breaking the Rules.
On Breaking the Rules, we talk about all things OCD.
Obsessive compulsive disorder, OCD, impacts up to 1 to 2% of the population. We are here to provide not just education, but to inspire clinicians, families, and people who are impacted by OCD to be able to access the treatment they need in order to get better.
Catch us every fortnight, wherever you get your podcasts.
Hello. How are you?
Yeah, still good.
Yeah?
Yeah. Always good.
Yeah, always good. Gratefully.
Yeah.
I'm just excited that I get to sit cross-legged.
I know.
Yes, in different ways. If you haven't caught up, baby's been evicted.
Yeah.
Welcome back for another episode of Breaking the Rules. Today we're going to do something a little bit different, but cool.
Yeah.
Play along. We're going to do an experiential exercise today.
Mm-hmm.
What the hell is an experiential exercise? An experience. It's basically something you do through learning.
Yeah.
Experience.
Yeah.
Right?
Yeah.
And so you learn through doing.
Yeah. And so this is something that I think that comes into play a lot when doing ERP because it is one thing to teach the skills, and often we find that our clients are very motivated and very willing.
Yep.
But at the same time, when they are triggered and they sort of move into fight, flight, freeze, it's really hard to be putting new skills into action. And that is not just for OCD.
It's for anything.
For anything, right?
Exactly.
And so to be able to do them, to do some of these exercises in the room is a great way to teach and to also then sort of mentor, coach your client through the experience so that they're better able to put it into action when they're at home.
Yeah. Cool. Thank you.
Yeah.
One of our favorite ones, actually you get a lot of experiential exercises through acceptance and commitment therapy, dialectical behavior therapy as well, ACT and DBT. And one of my favorite ones is the Mentos exercise. We don't have Mentos. We have Jellybeans today. And I call it the Mentos exercise because that's how I learned it. I learned it at one of Russ Harris's workshops.
And if Mentos is listening, you're welcome to sponsor our show.
Oh, yeah. Thank you, Mentos. I love the lemon flavour, just putting it out there.
You like lemon.
Yeah.
Lemon's the worst.
But you know me, I love lemon everything.
I know, but pink's the best.
The pink one?
Yeah.
Nah, it's too strawberry-ish. Is it even strawberry or is it raspberry? Anyway, we're going off on a tangent.
I don't know.
That's the way my brain works. It's from one thing to the next thing. Anyway, so it's one of my favourite exercises because it's something you can also do with your loved ones at home, which I think is one of the closest ways to explain to a loved one what it's like to experience a compulsion and how futile it is when your parents or your partner or your whoever, loved ones around you, say, just stop doing them.
Yeah.
Right? In that voice exactly. And so play along. It's a really good one. And re-listen, write it down, whatever, if you want to use it with your clients, it's a good one to use. Okay, so Tori's going to be my volunteer to give her voice a bit of a rest because she's not feeling very well today.
So croaky.
Yeah, so we have these beautiful Jellybeans. Thank you also, Jellybeans, for sponsoring our show. Not really, but if you want to, go ahead.
Gimme. Just don't give me a black one. No, don't.
Exposure therapy at its height.
Don't. I've done licorice in session in solidarity with a client who was doing exposure work.
Yeah.
I despise licorice, but I did it.
So do I.
You're
in good company. I also despise licorice.
Ugh.
The anise, I can't. Anyway.
Oh, God.
You can take a pick.
Oh, bless you. All right, pink.
Pinky pink.
Pinky pink.
Match my shoes.
Yeah, cute. All right.
Now.
All right, I've got my jelly bean.
While you're holding on to it, we're going to just focus on the breath for just a second.
Okay.
And then I'll get you to pop it in your mouth.
Okay. All right.
You sitting comfortably?
Very.
Would you like to keep your eyes open or closed? What's going to be less distracting for you?
Closed probably.
Closed? Okay. So when you're ready, you're feeling comfy, close your eyes. And for the next few moments, I'm going to invite you to just bring your attention to your breath. Don't change your breath. Don't do anything. Just notice it. Notice how you're breathing in and out. Notice your breath flowing in and out of your nose. Notice how it's slightly cooler as you breathe in and warmer as you breathe out. Notice your mind's chatter and just let it be. Let it hang and bring your attention back to your breath if you get distracted. You might start to notice different feelings in your body, different sensations, different sounds happening. Again, if you get distracted, just gently bring your attention back to your breath. Noticing its rate and rhythm. When you're ready, you can pop the Jellybean into your mouth. And when it's in your mouth, I don't want you to move it around, just leave it on your tongue. You can't chew it, you can't swallow your saliva, you can't do anything. So the aim of this is to hold your saliva while the Jellybean is in your mouth. Get the giggles out before you put it in, otherwise I'm just going to see the slobber going everywhere.
I already feel very uncomfortable.
Yeah, that discomfort's already rising.
Okay, here we go.
When you're ready. Okay, so the Jellybean's in your mouth, is just sitting on your tongue. We're not swallowing our saliva. We're going to try and hold that. We're going to surf the urge to swallow saliva with the Jellybean in your mouth. So your mind is already probably presenting you with lots of images, urges, sensations. Try and notice them and sit with them for as long as you can. Again and again, you'll get hooked and distracted. The saliva is probably building up right now. You might start to taste the flavour of the Jellybean as it's coming up. Notice the urge to want to swallow. Thank your mind for the urge. Come back to the discomfort. Lean into it. Don't push it away. Move towards it as much as you can. Just let it fill your body from head to toe. And just let it be. Notice any tension that might be coming up. Notice how strong the urge is getting, or it might even be plateauing, or it might be going up and down. Notice the pattern. Keep holding it. Keep noticing it. Keep leaning into the discomfort. And when you're ready, you can swallow your saliva and either spit the lolly out or enjoy it. I'm going to invite you to gently bring your attention back to your breath. Letting go of the tension. Noticing your breath once more. Noticing the taste of the Jellybean. Again and again, you might get hooked or distracted. Come back to the breath. And when you're ready, you can open your eyes and notice 3 things you can see in the room around you. Notice the position of your body on the chair. Notice how you're sitting. Notice any sounds in the room. And here we are. All right, let's debrief. How was that for you?
Uncomfortable.
Yeah. What did you notice?
So many things. Okay. I noticed how quickly I became uncomfortable.
Yep.
And how, which is I find really interesting about, because I have done this exercise before.
Yeah.
It's amazing how it doesn't matter.
No,
It
really
not matter.
doesn't. No.
It does not matter that I've done it before,
Yeah.
or that I know what it's all about.
Mm-hmm.
It doesn't change just how uncomfortable this stuff is.
Yeah.
So I really noticed how quickly my body started to hold the tension.
Yes.
And how hard I had to work to relax my body, because I was just really like I was bracing myself as though something really bad was happening.
Mm-hmm.
I noticed the influx of images.
Yes.
About like having a mouthful of saliva, about, you know, like this overflow, about embarrassment, about, you know, that started to happen. And I noticed sort of thoughts like, when is this going to end? When is this going to be over? This is taking forever. I want this to end. So like the urge to resist and to push it away and to make it go away was really strong. And the other thing actually that I really noticed as well was the need to tap into a good enough reason to keep going, to persist with it, you know, like to make meaning from it.
Yeah.
That really helped, that while I was sitting there and I was observing what was happening and I was getting sort of these, you know, thoughts to stop it and end it, was the thoughts around, well, you know, what is this exercise for? And at a personal level, so what does this do for me? But also at a sort of a community level, like what will this mean for our listeners if they hear me, you know, really do this in full and really get to the end? And
I love that.
And then once I'd really felt like I'd reconnected with that meaning, which I had before, but it kind of disappeared once the discomfort started to rise. That once I reconnected with that, everything kind of softened for a moment. And it's not that the discomfort went away, but the intensity, my body softened, my mind got a bit quieter. And the meaning and purpose was actually really important, I think, for managing it.
I love that, because what you've beautifully described is that idea of the point of acceptance.
Yeah.
Right? But you connected with meaning to help you reach acceptance.
Yeah.
Which then allowed, like you said, the noise and the discomfort's still there, but your ability to tolerate it changes.
Yeah. Yeah.
Which is so powerful. It's such a powerful lesson.
Because it's not as though in that moment there was less saliva in my mouth. I hadn't escaped anything, actually.
The circumstance didn't change.
No.
But your relationship to the circumstance changed. Yeah. Which is a really powerful lesson.
Yeah.
It's just, intrusive thoughts. You got images, intrusive images. Did you get any intrusive thoughts?
Yeah, intrusive thoughts about like drooling on camera.
My evil laugh.
Yeah, there was definitely that.
Yeah. Oh my God. Thank you so much for sharing that. The takeaway from that is, it's a nice exercise to do to teach your clients what doing exposure and response prevention is like. Really, that's essentially the essence of it.
Yeah.
The exposure being the discomfort to doing something that could potentially be embarrassing, and the response prevention being don't swallow your saliva.
Yeah.
Which it's a swallowing saliva would be, correct me if I'm wrong, a voluntary reflex. Is that right? In that, as in we can interrupt it if we wanted to.
I'm going to say yes.
Okay. that's an I'm not sure look, but that's okay. People want to drop comments, and if they're on YouTube and they want to correct us in the comment section, go ahead.
Yes.
I have a feeling it's an involuntary reflex.
Have been at the cafe at uni getting coffee during that lecture.
I was the fastidious one sitting there
likely in the beer garden,
taking 10 million pages of notes. Anyway, so I think because it's a voluntary reflex, I think in a sense that, yes, we could interrupt it and interfere it, but at the same time, it's a really hard one to
resist.
Yeah. I remember when I was doing it, I had intrusive thoughts around choking or all that sort of stuff too. So lots of things can come up. It's also a really good one to do with your family and loved ones, like I mentioned earlier, and you can see why now that we've done it. Is to help build understanding.
Yeah, that's right.
And empathy. And how hard it is, because everyone will struggle. A lot of people struggle with it.
Yeah.
If your client does swallow their saliva, which some clients do, then that's okay. It's not that the idea is to swallow completely, to resist completely. It's to then go, okay, see if you can go longer the next time.
Yeah, that's right.
So you keep going with the exercise, but you just get them to keep going for a little bit longer.
Which mirrors ERP.
It does.
In terms of,
absolutely.
Inviting people to delay, their compulsion.
Yep.
Rather than extinguish it completely.
Exactly.
The same idea.
Absolutely.
Just keep persisting.
Yeah.
Yeah.
If you're on telehealth, then you don't necessarily always need a lolly. You could just ask your clients to hold their saliva.
Yeah.
So mouth closed and just let it build naturally without any stimulus in there to get it going. So you don't always need a lolly. And same with in session as well. If you don't have access to lollies, then that's fine as well.
Yeah.
So a little tidbit.
Just makes it fun.
Yes.
Bit more novel.
And exciting.
Yeah, that's right. Yeah.
And it's a great one to do with young teens.
Yeah,
They would love, like, and young
I know. We do it in our teen
children as
group,
well.
don't we?
Yeah, they love
in our
it.
teen group.
Yeah.
Well, I mean, I think love might be a little strong.
Yeah. They don't love it.
I don't think they love it.
I think they love the Mentos.
They love the Mentos.
Because we just have the bag there and they munch on it all night. I mean, not all night, during the time we have them. But but they do. They get into it.
Yeah.
So it's a good one to do with kids as well to help explain what exposure response prevention is.
Yeah.
So hopefully that's a good little takeaway for you guys.
That was fun.
Yeah. All right. Thanks so much for watching and listening. I always forget about that.